Philanthropy.
Frontline.
Philanthropy.
Frontline.
Philanthropy.
All right, thank you guys so much for having me here today. My name is Katharine Wales, and I'm here on behalf of Medtronic Foundation. And today I'm really here to speak with you about medical innovation, philanthropy, and the Frontline. And I'm really glad all of the songs that were played beforehand. It's been such a privilege to be here, learn all these new songs, learn all these new people, and be really a part of the story today. Okay, sorry. So first of all, as quick context, just wanted to share a quick background on Medtronic and Medtronic Foundation. For those of you that aren't familiar, Medtronic is a global company. We're really focused on creating medical technologies and solutions to improve healthcare for around the world. You might be familiar with some of our products like pacemakers, insulin pumps, things that are really important in healthcare today. As a foundation, we are then really focused on expanding access to healthcare for the underserved, and that's a core part of our work. And so we're excited to be part of this conversation and really appreciate IntraHealth including us in today's work. When you all think about healthcare innovation and you're looking up things online, you're probably reading a lot about technology, right? You're looking at things like Amazon Echo, and not only can you now order anything you want from your family just from sitting in the living room, but it's also seeing really interesting implications in healthcare. So how can the Amazon Echo be monitoring someone that's sitting at home by themselves? It starts noticing that someone's been coughing, suggests maybe that they need to actually go see a healthcare provider, links up with a healthcare system. That's an incredibly powerful technology tool. And of course, we have a picture of the Fitbit here. Who's not familiar with that? A number of people have Fitbits. We see everybody kind of competing with their friends, their coworkers. I've seen a lot of interspousal competitions, who walked the most today. It's really changing how we view health. And then, of course, I just have a picture up here, IBM Watson. Who hasn't seen a commercial for the power of big data in healthcare? And really this awesome opportunity of how can we not only now just go to one doctor, but really get opinions of looking at different scans from around the world. How do I know who the best doctor is for me, given my conditions and my factors? So technology has an incredibly important place in healthcare innovation, and certainly when you look at the news, it's really out there. But I wanted to just compare that with, or make the point that healthcare technology isn't the only part of it. And I think it's really interesting because none of us planned it this way, but I think we've all been making similar points throughout our presentations that it really comes down to people also. And so this is an interesting quote that stood out for me from a year ago, but when I was working over at UNC Healthcare, they were working and partnering with a local retirement community. And it was interesting because they were doing a lot of research in partnership with them and putting different robots into people's rooms and really trying to understand how can we really best provide the best care using technology. And I'll never forget they asked someone there, how do you like this technology? And the man said the quote up here, the technology doesn't do that much, but I really like that people come check on the technology and they ask me how I'm doing. And so it was a really rude awakening, but I think something that really stuck with me. So that's really the point here is, we understand that technology is important, but it's not the only piece, and it's really also about people. So Medtronic Foundation for the past few years has been excited to work with IntraHealth and really partner on this Frontline coalition and frontline health worker work, and really raising the importance and helping to get people more aware of all the different roles that are out there and what the opportunities are. And so I think, first of all, for some of you, the term frontline health worker might be new. It's a pretty ambiguous, broad term, but really what we mean by that is these are people that are really the first point of contact with healthcare for many people. It really ranges in things like community health workers, paramedics, midwives, pharmacists, nurses, doctors. It's really the full range of healthcare. And we really believe that these are really important people because they're often from the community. They often really understand the challenges that people locally that they're working with are facing. And they're also really there to link families to other parts of the healthcare system, other parts of social services and infrastructure. And that's really what healthcare is about. And I think it's exciting because kind of when I look at it and take a step back, it's really about overlaying health on existing behaviors and community and not saying, let's just create this standalone hospital that's separate and people have to go to and that's where healthcare is, but really recognizing that healthcare isn't just when you go to a doctor, it's everything that you're doing every day. And these frontline health workers are really there to lead the charge. Why does Medtronic Foundation care about this? Well, as a company, we're really focused on non-communicable diseases. So things like diabetes, cardiovascular disease. And we know that these are not diseases that you can just go to a hospital, you've gotten a cure, you're done, move on with your life. And I think it's a really exciting time because, well, it's exciting and challenging, right? We see NCDs on the rise. And I know a lot of you are in the room and work in global health, and you're very well aware of this. It also means it's a time for us to reimagine how all the players in healthcare come together and really elevates the importance of the role of the frontline health worker in addressing a lot of these things. And I just wanted to throw a couple stats up here because when I was doing some research, I was trying to think, if at the end of the day, there's a lot of great devices and drugs out there, but it's really about how do you get people to stick with those, what does it look like today? And so certainly in different countries, there's going to be different statistics. But looking at some interesting stats, especially around obesity and weight loss, there's an 18% adherence rate that people have when they're told they need to adopt a new exercise regime. So that really says that just being told you need to do something, we all know this, right, isn't really the way that people are going to change their health care. And then for patients that are taking long-term chronic disease medications, there's really only a 50% adherence rate. So we can do a lot better. And that means really thinking outside of the hospital system and thinking outside of the way we're delivering care and really looking at all the other players. We've done a bit of work in trying to highlight some of these success stories to date with frontline health workers around NCDs in partnership with IntraHealth. And it was really fun to kind of release a policy paper looking at some of these case studies, but just a couple I wanted to highlight here was there was some research done looking at a program in Pakistan that was really focused on if you educated frontline health workers not only to be great at treating and diagnosing things like diarrhea, malaria, HIV, but also shifting some of their focus to more NCDs, just with a short education around what is hypertension, how do they work with patients, they were actually able to see after just a few weeks an increase in how people were doing, especially youth and young adults with hypertension. Similarly with South Africa, there was a study done educating frontline health workers around what are the risk factors for cardiovascular disease and how do you screen just by looking at certain things. And after just a very short training, frontline health workers had the same rate of diagnosing as actual providers. And so there's a lot of room for reimagining healthcare in how that's really being delivered. Some of the key challenges today, we see big opportunity, but there's really a significant shortage of health workers. And a lot of this also has to do with how can we collectively elevate the role of frontline health workers so that it's seen as a really highly sought after field to go into and really valued by communities. We also are seeing that health workers aren't sufficiently compensated. And of course, for anyone's work, a lot of people could say, there needs to be more pay. But I think in this case, in some instances, there's definitely not enough funding just available. But it also is a reallocation of funding. So there are even ministries of health that have funding. How can we help them understand that it is more cost effective in a lot of cases to be providing more financial services for frontline health workers so that they can be out there? We're also seeing that oftentimes the frontline health workers, especially even in the United States, really aren't integrated with the overall health system. So we see a lot of health systems maybe saying, well, we have this electronic health record system, we're paid in this way. And I used to work at a health system in the US, and I understand these challenges, but they're really not then integrating in with community health workers and people that are really in the front lines. And that's a really important thing, both in terms of increasing quality of care, but also in overall decreasing these costs. And then finally, there's really a push for all of us to be advocates to help expand the scope of practice for frontline health workers around NCDs. And it's a new field. The practices are largely behind the times in terms of what are people allowed to do, but I think there's definitely a growing movement in this space. So I'm putting up action items on here because we were really pleased to be partnering with IntraHealth to bring to you at Switchpoint 5 different frontline health workers to share their story. And so yesterday you heard Al speak and you heard Maria speak and really understood from their perspective, what do they really see as their biggest community needs and really understand the passion that they have in the work that they do. And following me, you're going to see 3 more frontline health workers tell their story. And I think it's really exciting because for a lot of them, this is their first time sharing their story with the audience. And so first of all, thank you all for being so warm and welcoming. But we want to make sure that their stories aren't just stories, that they're really kind of an impetus for something more. And so I wasn't really sure what the audience was going to look like, so I was trying to draw out some action items for those of you that are here. But I think for students, it's really important just to call out that healthcare isn't just about what happens in a hospital. And if there are opportunities for you to either, shadow a high-performing frontline health worker or advocate for your professors that becomes part of your curriculum, that will really make healthcare more important going forward. Really understanding that patient empowerment is about relationships and understanding how do you tailor that healthcare. If you're a global health program manager and maybe you're working at IntraHealth, RTI, and you're leading a lot of developing new initiatives, we would really advocate that it's important that you include frontline health workers in your program planning and soliciting of new ideas. And so we have 5 fantastic frontline health workers here. They're by no means the only frontline health workers, but I think they have really great ideas, and to include them early on in the conversation so that programs are most effective down the road is really important. And then the last piece is if you're a healthcare worker, so maybe working at a hospital, whether it's in the United States or somewhere else, really be that voice in your system that's advocating that frontline health workers are included in advisory boards. And it's not just 6 neurosurgeons that are talking about how can we best work with this patient, but really including someone from the front lines that understands the rest of the 80% of what a patient is facing. So that's what we really want. That's why I'm up here today, is just to kind of provide some more context for the stories that you heard yesterday and the stories that you're about to hear following me, and just to say thank you all, and really hope that you have a chance to kind of remember the voice of frontline health workers and carry that into your work going forward, and appreciate you all being advocates for their stories today and then beyond. So thank you, guys.